If you're past 60, what I'm about to share might disturb you deeply. After speaking with countless healthcare professionals over decades of advocacy work, I've discovered some troubling realities about how medical providers approach senior patient care. These 5 hidden truths are potentially costing you proper treatment, respect, and maybe even precious years of your life. One retired nurse practitioner told me this represents healthcare's best-kept secret. Don't walk into another medical appointment unprepared. This information could literally be life-changing. What you're about to learn will revolutionize how you navigate the healthcare system. Today, I'm revealing 5 concerning patterns in medical ageism that the healthcare industry rarely discusses openly with patients. Here's what we'll explore together. First, the immediate mental calculations that happen when doctors see your birth date. Second, how economic factors secretly influence your treatment options. Third, the dangerous way your symptoms get filtered through outdated assumptions. Fourth, medication practices that specifically target older patients. And fifth, the most damaging misconception about your mental sharpness that affects diagnosis quality. Here's the hopeful part, though. I'll share the exact approaches that savvy seniors use to completely change these dynamics and receive outstanding health care. If you've ever felt overlooked, rushed, or patronized by medical professionals, this discussion will equip you with tools to ensure that never happens again. Please hit that like button if you're ready for honest conversation, and make sure to subscribe with notifications because this knowledge could genuinely protect your well-being. Share in the comments your most frustrating healthcare experience. Let's dive in. Truth 1. They immediately categorize you as time-intensive and costly. The moment you enter any medical facility, your age automatically triggers specific mental processes in your healthcare provider's mind. Medical professionals are systematically trained to evaluate resource requirements, and patients over 60 consistently fall into what they consider the high-maintenance category. This isn't necessarily intentional discrimination. It's ingrained systematic thinking that influences every single interaction you'll experience. Dr. Elizabeth Thompson, a former emergency department physician who now advocates for patient rights, shared some eye-opening insights with me. She explained that medical training includes efficiency protocols that essentially pre-sort patients by demographic categories. Older adults are presumed to need extended appointments, multiple diagnostic tests, and complicated medication oversight. This creates subconscious prejudice before any examination actually begins. Financial pressures really amplify this bias significantly, with insurance payments decreasing and patient quotas increasing. Doctors experience genuine economic stress when treating seniors. Your comprehensive healthcare needs often conflict with their constrained schedules. This honestly creates underlying tension that can impact the attention and care quality you receive. Research demonstrates that physicians spend approximately 25% less time actually listening to patients over 65 compared to younger individuals presenting identical symptoms. Consider what happened to 72-year-old retired teacher Margaret from Portland, Oregon. She arrived at her appointment with a carefully prepared list of symptoms she'd been monitoring for several weeks. Before she could complete her opening statement, her doctor interrupted, saying, "Let's concentrate on your primary concern today." When Margaret attempted to explain how all her symptoms seemed connected, the physician simply sighed and replied, "We need to establish priorities." Her chest discomfort was dismissed as stress-related, ultimately delaying a cardiac diagnosis by 8 months. This complexity avoidance extends beyond simple time management. Doctors frequently hesitate to order comprehensive testing for seniors, anticipating that results will reveal multiple conditions requiring extensive treatment protocols. They'd honestly prefer addressing surface-level symptoms rather than investigating deeper and potentially discovering systemic health issues. The psychological impact runs quite deep. When healthcare providers approach you with preformed assumptions about difficulty and expense, they become far less likely to collaborate with you on personalized treatment strategies. Instead, they default to standardized protocols designed for typical senior conditions rather than investigating your unique circumstances. Here's how to immediately counter this bias. Start every appointment by clearly stating your specific, measurable health objectives. Rather than saying, I feel exhausted, try my energy levels have dropped by 50% over the past 2 months, and I need to identify the underlying cause. This transforms you from a complicated senior into a goal-focused patient in their perception. Prepare a concise, one-page health summary highlighting improvements you've achieved through previous treatments. This demonstrates you're an active participant in your healthcare journey, not merely a passive recipient of medical services. Healthcare providers respond much more positively to patients they view as partners rather than problems to solve. Request specific timeframes for addressing your concerns. Say something like, Doctor, I understand our time is limited today. Could we schedule a 45-minute appointment next week to thoroughly examine my cardiovascular symptoms? This shows respect for their schedule while simultaneously advocating for appropriate medical attention. Always document everything during appointments. When doctors observe you taking detailed notes, they realize you're engaged and will remember specifics. This accountability factor genuinely changes their communication approach and professional behavior. Truth 2. They use polite medical dismissal to explain away your symptoms as normal aging. Medical dismissal targeting seniors has become so routine that healthcare professionals often don't recognize they're engaging in it. When doctors attribute legitimate symptoms to normal aging processes, they're employing a socially acceptable form of discrimination that significantly delays proper diagnosis and effective treatment. Dr. Robert Martinez, a geriatrician who dedicated his career to combating ageism in medicine, explains it perfectly. The phrase "you're getting older" has become a medical excuse. It's used to dismiss symptoms that would immediately trigger thorough investigation in younger patients. This represents assumption-based medicine, not evidence-based healthcare. The statistics are genuinely alarming. Research from the American Geriatric Society reveals that 87% of serious medical conditions in seniors are initially attributed to aging before receiving accurate diagnosis. Heart disease presents as fatigue from getting older. Thyroid disorders become normal energy decline. Depression gets labeled as adjustment to life changes, and cancer symptoms are dismissed as simple wear and tear. Consider 65-year-old former contractor David from Chicago. For 10 months, he reported increasing joint stiffness and overwhelming fatigue to his family physician. Every visit produced the identical response. David, you're not 30 anymore. Your body is naturally slowing down. When David finally insisted on blood testing, they discovered severe rheumatoid arthritis that had caused irreversible joint damage during those dismissed months. The dismissal follows predictable patterns. Doctors use phrases like, at your age. That's expected, or we all slow down eventually, to redirect conversations away from actually investigating concerning symptoms. They'll recommend generic solutions like more exercise, improved sleep, or stress reduction without determining why these issues suddenly developed. Women face double discrimination, with symptoms dismissed as both aging and hormonal fluctuations. Men's concerns about sexual health or emotional changes get brushed aside as normal male aging processes. Mental health issues receive particularly dangerous treatment, with depression and anxiety attributed to life stage transitions rather than investigated as treatable medical conditions. The most harmful aspect is how this dismissal makes seniors question their own experiences. When medical authorities repeatedly tell you that worrying symptoms are, quote, normal, you start doubting your own judgment. This self-doubt delays seeking medical help and honestly worsens health outcomes significantly. Here's your protection strategy. Always respond to age-based dismissals with specific questions. When a doctor says that's normal for your age, ask what percentage of people my age experience this exact symptom level. What research supports that this severity is typical? Most doctors cannot provide evidence because they're making assumptions, not medical assessments. Create detailed symptom timelines that demonstrate sudden changes rather than gradual decline. Instead of saying I'm more tired lately, present concrete data. My energy levels remained stable until April 10th, when I began requiring afternoon rest for the first time in 20 years. This transforms your concern from an aging complaint into an acute onset symptom requiring investigation. Request specific diagnostic criteria by asking, "What tests would you order if I were 40 with these identical symptoms?" This forces them to justify different treatment standards based solely on age. Often, they'll recognize their age bias and order appropriate medical investigations. Use the concern escalation technique. State clearly, "Doctor, I understand aging affects energy levels, but this represents a dramatic change from my normal baseline. I'm concerned this could indicate an underlying medical condition. What diagnostic steps can we take to rule out medical causes before attributing this to normal aging?" Bring a healthcare advocate to appointments. When another person witnesses dismissive behavior, doctors typically modify their responses. Your advocate can ask follow-up questions you might miss and help document the entire conversation accurately. If you're recognizing these patterns in your own healthcare experiences, please let me know in the comments section and hit that like button if this information is helping you understand your medical encounters better. Truth 3. They assume your mental abilities are declining and simplify treatment unnecessarily. One of the most damaging assumptions in senior healthcare is the presumption of cognitive decline. Doctors routinely oversimplify treatment explanations, avoid complex therapeutic options, and make medical decisions based on age-related intelligence stereotypes rather than individual mental assessment. Dr. Patricia Williams, a neuropsychologist who researches medical bias, reveals the disturbing reality: healthcare providers consistently underestimate cognitive capabilities in patients over 65. They'll recommend simpler, less effective treatments because they assume seniors cannot manage sophisticated medical regimens. This creates a devastating cycle where seniors receive suboptimal care due to completely unfounded assumptions about their mental capacity. The impact extends far beyond hurt feelings or wounded pride. When doctors believe you cannot understand complex treatments, they don't offer cutting-edge therapies, detailed treatment alternatives, or comprehensive diagnostic procedures. Instead, they default to basic interventions requiring minimal patient participation or understanding. Consider 73-year-old retired engineering professor Louise from Boston. When diagnosed with early-stage breast cancer, her oncologist immediately recommended a straightforward mastectomy without discussing reconstruction possibilities, targeted therapies, or available clinical trials. He justified this decision by saying, "At your age, we prefer keeping things simple." Louise had to advocate for months to access the same treatment protocols readily offered to younger women with identical diagnoses. This cognitive prejudice manifests in subtle but significant ways. Doctors speak more slowly, use elementary vocabulary, and provide oversimplified explanations to seniors, regardless of education level or demonstrated intelligence. They'll skip technical details that would help you make truly informed decisions, assuming you wouldn't understand anyway. The medication management assumption proves particularly dangerous. Healthcare providers often choose less effective drugs with simpler dosing schedules. Believing seniors cannot manage complex medication regimens, they'll prescribe once-daily medications that provide less therapeutic benefit than multiple dose alternatives, prioritizing perceived compliance over optimal health outcomes. Technology discrimination compounds this problem substantially. Doctors assume seniors cannot use health monitoring applications, electronic medical portals, or digital communication systems. This assumption cuts you off from modern healthcare tools that could significantly improve your treatment outcomes and provider communication. The self-fulfilling prophecy becomes tragic when seniors internalize these lowered expectations. After repeated experiences of simplified explanations and dumbed-down treatment options, some seniors begin believing they actually cannot handle complex medical information, creating genuine dependency where none previously existed. Here's how to immediately shatter these assumptions. Begin every medical conversation by mentioning your educational background, professional experience, or relevant expertise. You might say, "I manage complex engineering projects for 35 years, so please provide the detailed medical information I need to make well-informed decisions." Don't hesitate to request technical explanations using proper medical terminology. Ask something like, "Doctor, can you explain the pathophysiology of my condition and how each treatment option addresses the underlying disease mechanisms?" This demonstrates your desire and capacity for sophisticated medical information. Bring evidence of your cognitive abilities, articles you've researched about your condition, questions you've prepared based on medical literature, or notes from other specialists. This tangible proof of your engagement forces them to abandon their unfounded assumptions. When given simplified recommendations, challenge them directly. Ask, "What additional therapies would you recommend if I were 45 with the same condition?" I want to understand all available options. Regardless of complexity, use technology proactively during appointments, access your health applications, reference your digital medical records, or use your smartphone to research medication interactions right there during the consultation. When doctors observe you're comfortable with technology, it challenges their assumptions about senior capabilities. Request detailed written treatment plans and medication information. Tell them, "I want comprehensive documentation of my treatment options so I can review and research each recommendation thoroughly." This makes absolutely clear you intend to be an active, informed participant in your healthcare decision-making process. Truth 4. Medications become tools for managing your behavior rather than treating actual medical conditions. Perhaps the most disturbing truth about senior healthcare is how medications are used to control behavior rather than treat legitimate medical conditions. Healthcare providers frequently prescribe psychiatric drugs, sedatives, and mood stabilizers to seniors, not because of diagnosed mental health conditions, but because these medications make patients easier to manage in medical settings and care facilities. Dr. Jennifer Rodriguez, a former nursing home medical director who now works as a patient advocate, exposed this troubling practice. She told me, "I witnessed countless cases where medications were prescribed not to improve patient health, but to reduce staff workload. Anxious seniors received sedatives. Assertive patients got mood stabilizers. And those asking too many questions were given antidepressants." It's chemical restraint disguised as medical care. The statistics are honestly horrifying. Over 42% of seniors are prescribed at least one psychiatric medication, yet only 14% have diagnosed mental health conditions requiring pharmaceutical intervention. The remaining prescriptions serve administrative convenience rather than medical necessity. These drugs often cause dangerous side effects including falls, cognitive impairment, and increased mortality risk. Consider what happened to 67-year-old former school administrator Beverly from Denver. After her hip surgery, she became frustrated with slow rehabilitation progress and started asking detailed questions about her recovery timeline. The healthcare team labeled her as difficult and prescribed anxiety medication to help her relax. The medication caused confusion and balance problems, leading to a fall that fractured her wrist. While her original injury healed, the medication complications extended her recovery by 6 months. The use of medication for behavioral control extends beyond psychiatric drugs. Doctors routinely prescribe sleep aids for seniors experiencing normal age-related sleep pattern changes, not actual sleep disorders. Pain medications are withheld from seniors with legitimate pain complaints because providers assume they're drug-seeking or exaggerating discomfort for attention. Blood pressure medications are often prescribed at doses causing dizziness and fatigue, making seniors less likely to be active or assertive during medical appointments. When patients complain about these side effects, doctors dismiss them as necessary trade-offs instead of adjusting medications or exploring alternative treatments. The most insidious aspect is how these medications create the very problems they claim to treat. Sedatives cause confusion that gets labeled as dementia. Mood stabilizers lead to apathy that gets diagnosed as depression. Sleep aids disrupt natural sleep cycles, creating actual sleep disorders requiring additional medications. Healthcare facilities actively encourage this practice because medicated patients require less staff time and attention. Insurance companies support it since psychiatric medications cost less than proper medical evaluations or therapeutic interventions. Sometimes families request it because they cannot handle their loved one's natural emotional responses to health challenges. Your defense starts with understanding exactly what each medication treats, Before accepting any prescription, always ask, what specific medical condition does this medication treat? What objective measurements will determine if it's working? How will we know when to discontinue it? Avoid medications prescribed for vague reasons like anxiety or agitation without clear diagnostic criteria. Research every medication independently using reliable medical databases. Look for side effect profiles, interaction risks, and alternative treatments. Many behaviors prompting psychiatric prescriptions can be addressed through environmental changes. Therapy, or treating underlying medical conditions, always demand specific treatment goals and timelines. Say, I want measurable objectives for this medication. If I'm not seeing specific improvements within a defined time frame, I want to discontinue it and explore alternatives. This prevents indefinite use of psychiatric medications. Request medication reviews with independent pharmacists or geriatric specialists. These professionals can identify unnecessary drugs, dangerous interactions, and deep prescribing opportunities. Many seniors discover they're taking medications with no therapeutic purpose. Document your cognitive and physical abilities before starting psychiatric medications. Take cognitive assessments, balance tests, and mood evaluations. This baseline helps you identify medication-induced changes and provides evidence if you need to advocate for discontinuation. Create a support network that can advocate for you if medications affect your judgment or assertiveness. Choose someone who will question medical decisions and ensure your voice remains heard. Even if psychiatric medications alter your personality or cognitive abilities, share this video with other seniors if you found this information valuable. And please subscribe to our YouTube channel for more healthcare advocacy content. Truth 5. They calculate your life's remaining value when recommending treatments. The most heartbreaking reality in senior healthcare is how medical professionals use economic calculations that weigh treatment costs against remaining quality life years, often resulting in seniors receiving inferior care not because of medical factors, but because of age-based value assessments. Dr. Sarah Chen, an ethics professor studying healthcare rationing, reveals this shocking truth. Medical training includes concepts like quality-adjusted life years that essentially assign numerical values to different lives. A 70-year-old's remaining years are calculated as less valuable than a 40-year-old's, influencing everything from organ transplant decisions to cancer treatment recommendations. It's systematic age discrimination disguised as medical economics. This valuation system affects treatment decisions in devastating ways. Seniors are routinely denied expensive procedures, cutting-edge therapies, and aggressive treatments not because they wouldn't benefit, but because the healthcare system has decided their remaining years aren't worth the financial investment. The same surgery readily offered to younger patients becomes too risky or not cost-effective for seniors with identical health profiles. Consider 66-year-old retired mechanic Walter from Phoenix. When diagnosed with kidney failure, he was immediately directed toward palliative care and told that dialysis might not be appropriate at his age. Walter fought for 4 months to access the same life-saving treatment routinely offered to younger patients. After finally starting dialysis, he returned to full activity levels and lived 8 more productive years. Years he would have lost if he'd accepted the initial age-based treatment recommendation. The discrimination extends to diagnostic procedures as well. Expensive imaging studies, specialized testing, and preventive screenings are often denied to seniors based on actuarial calculations rather than medical need. Insurance companies and healthcare systems use age as a primary factor in approval decisions, assuming seniors won't live long enough to benefit from early detection or prevention strategies. Mental health treatment receives particularly harsh age-based rationing. Depression and anxiety in seniors are dismissed as natural responses to aging instead of being treated with the same therapeutic interventions offered to younger patients. Psychological therapy, psychiatric care, and mental health medications are considered wasteful for people assumed to have limited remaining time. The tragedy deepens when seniors internalize these value judgments. After repeated experiences of diminished care recommendations, many seniors believe their lives are less worth saving. They stop advocating for aggressive treatments, accept substandard care, and make end-of-life decisions based on society's devaluation rather than their own desires for continued living. Emergency room treatment reveals the starkest discrimination. Seniors presenting with identical symptoms receive fewer diagnostic tests, shorter examination times, and quicker discharge decisions compared to younger patients. Emergency physicians privately admit that age influences their clinical decision-making. With older patients receiving less comprehensive medical workups, the economic calculations become particularly cruel during family discussions. Healthcare providers subtly influence families to choose less expensive care options for senior relatives. Framing limitations as comfort measures or age-appropriate care, families are encouraged to consider the burden of aggressive treatment without understanding the full range of available options. Your life has equal value regardless of age, and you must advocate accordingly. Always ask, would you recommend the same treatment if I were 45? If not, please explain the medical, not economic, reasons for different recommendations. This forces providers to justify age-based treatment discrimination. Research treatment outcomes for your specific condition in patients your age. Many seniors have excellent treatment responses that contradict age-based assumptions. Bring this evidence to medical consultations and demand access to all appropriate therapies regardless of cost considerations. Seek multiple medical opinions, especially from geriatric specialists who understand senior treatment outcomes. Many conditions prompting comfort care recommendations from general practitioners have effective treatments when managed by age-focused specialists. Use legal advocacy when necessary. Age discrimination in healthcare violates federal laws, and legal advocates specializing in senior rights can help you access denied treatments. Document instances where age appears to influence treatment recommendations. Connect with senior advocacy organizations that can provide support and resources for fighting healthcare discrimination. These groups understand system biases and can guide you through appeals processes and alternative treatment options. Remember that you have the right to refuse age-appropriate limitations on your care. If you want aggressive treatment, comprehensive diagnostic testing, or cutting-edge therapies, you can demand equal access regardless of your age. Your life value is not determined by actuarial calculations. Now you understand the 5 hidden truths about medical ageism that healthcare providers rarely discuss openly. But here's what changes everything. Knowledge truly is power, and you now possess the tools to transform every medical encounter from passive patient to empowered advocate. Remember Walter, who fought for dialysis and lived 8 productive years that doctors wanted to deny him? Beverly, who overcame medication-induced complications to reclaim her recovery. These aren't exceptional cases. They represent what happens when seniors refuse to accept discriminatory treatment based solely on age. Every time you challenge age-based assumptions, demand equal treatment, or advocate for comprehensive care, you're not just fighting for yourself, you're changing how the entire healthcare system treats seniors. Your assertiveness creates positive effects that benefit every older adult who follows in your footsteps. The medical establishment hopes seniors will remain passive, accepting inferior care without question, but you're different now. You recognize these biases, understand the discrimination, and possess strategies to overcome both. Your health, dignity, and remaining years are too valuable to surrender to age-based prejudice. Transform your healthcare experience starting with your very next appointment. You deserve medical treatment based on your individual health profile, not stereotypes about your age group. Your voice matters, your concerns are valid, and your life has immeasurable worth regardless of what any actuarial table might suggest. If this exposed the healthcare discrimination you've experienced, please hit that like button and share this video with every senior who deserves better treatment. Your story could genuinely save another senior's life. Comment below. Have you experienced medical ageism? What will you do differently at your next appointment? Let's support each other in demanding equal healthcare treatment. Please subscribe and hit that notification bell because every senior deserves dignity, respect, and life-saving medical care regardless of age. Together, we're changing healthcare for the better. Like, share, subscribe, and let's keep fighting for the respect and quality care we all deserve.